I'm Fleur, Program Manager at Tanangira Council Aboriginal Corporation in Alice Springs, Northern Territory.
And my name's Jillianne. I'm the Executive Officer at Jalara Homes in Meningie, South Australia.
It's been really great to reconnect with people that I've seen at other conferences and really hear and learn their stories and challenges that they've experienced in the aged care sector so far.
It's also really nice that the Commission wants to be open and to be seen as having a job to do and sort of demystifying who and what they are.
Today I've been at the second day of the National Provider Conference. I have found it very informative through all the executive from Commission. I found the changes that are made are very positive, and I'm looking forward to working with them as a home care provider in the future.
Hi, my name's Thomas. I'm a director of a home care provider on the mid-north coast of New South Wales. It's been really wonderful joining the conference and certainly hearing from the Commission and the Department around the upcoming changes and also how we're going to be working better together into the future.
Hi, I'm David. I'm Chair of the Board of a small not-for-profit community in mid-north coast of New South Wales, and this is my first conference and my first sort of interaction with the Commission, and it's good to see that there's some positive information coming to us about how the Commission's going to interact with providers like ourselves, and I look forward to the future. I think things could look good. We're a big reform, and we're willing to get into it.
I'm Resme. I'm from Beata Home Care. I'm at the conference today to learn more about the reforms and the changes that's coming up as well. So I'm really enjoying it. The conference has been very informative.
My name is Marilyn Murimararami. I'm from SEED West Multicultural Services in New South Wales, based out in Blacktown, Western Sydney. I'm here, to just have a listen to what the Commission has to say. And I'm very privileged to be here. It was good that the Commission is forwarding the message of collaborating with us as providers. I really like that.
We have learned a lot of things. The Commission is here. Inspector General, we had a panel that had consumers and providers. That was my highlight of the day, because it's important to involve and include the consumers. It's all about them, so we have to hear what their voice, what they have to say, instead of thinking and imposing things on them as we take care of them. So we're really happy for this conference that the Commission organised. Thank you.
I think the other part of it, reaching priorities, is difficult for us in regional areas and remote areas. So making those programs that have been designed with a more city type bend fit for our services is important too.
Yeah, and certainly the struggle that we have being in a rural and remote area to get good quality service providers in place, I think is one of the biggest challenges we're facing in the Northern Territory. For me, coming from the NDIS space into the aged care space, I think there's a lot of consistency between how the programs operate, and what I'd like to see is that it's not a one-size-fits-all approach, and that we need to be more proactive in identifying what it is that our clients want and need, particularly in a community-based setting, and really hearing their voice so that they feel safe, comfortable, happy, and they can live long and prosperous lives.
Hi, we're from People First Healthcare. One of the most important priorities we have as an aged care provider is navigating the changes over the next 12 to 24 months, and there was quite a few as we saw from the various department heads that have presented over the weekend, and it's really good to touch base with other providers, understand the challenges that they're going through, and we can sympathise with many of those, and it's great to be here all in the same facility and sharing those challenges and discussing solutions.
So for me, an ideal aged care experience is one that leaves the consumer and their family feeling like they've been included in all aspects of what their introduction to aged care has been, and then to have the freedom to have say in what they want to do about it.
It's really about one thing, and that is consumer choice and providing their dignity. And as we work towards that, we're going to be seeing a lot of changes and great changes for the future of aged care.
An ideal aged care experience is with me at the centre, me having full choice and control of what I want, listening to me, including my family and me in decisions.
It's one where we're providing a very pleasant experience for our older Australians in a safe and welcoming community, and we're doing it in a compliant fashion and listening to our residents. I think that's what it entails for us.
To me, I think the ideal aged care service is one in which we focus on the person that's receiving care and engage them through their care journey, and hopefully able to do that from early on when they're actively involved in decisions that affect their care, so that the provider gets to know them and can support those choices throughout their life and make it the most meaningful and enjoyable life possible for them.